Hi, my name's Russ Lamb and I'm one of the emergency doctors here at the Alberta Children's Hospital. Today, in this video, we're going to be taking you on a tour of our emergency department. It's important that you understand the process that occurs here in the department so that you know what actually occurs when you enter. This will make your stay here less stressful. Once you enter the department, the first thing that will happen is you'll be asked to stand behind the red line by the triage line. This is where you will meet a triage nurse. A triage nurse is the nurse who will assess how ill or injured your child is and what the next step should be. There are 2 rooms where this occurs, and when it is your turn, the nurse will ask you to enter the room. To make your assessment more efficient, please have your child's healthcare card available and take off any outerwear, as the nurse will need to take the child's vital signs and possibly examine parts of their body. The nurse is going to assess how unwell your child is, and in order to do so, they will ask you questions about your child, including what brought you in, what other conditions they have, any medicines they're on, and any allergies that they may have. The second part of their assessment will be to take a look at your child. Once this is done, they can better determine the severity of their illness and prioritize them in the system of children waiting to be seen. Please be patient when you come and visit us in the emergency department. We do not see patients on a first-come, first-served basis. We see our sickest patients first. The length of time that it takes for your child to be seen is determined on how sick your child is compared to how sick the rest of the children in the department are. This is actually true even if you're sent in via family doctor, public health nurse, or via ambulance. There are actually 2 waiting room lists when you visit us in the emergency department. The main waiting room list is comprised of patients who require lengthier investigations, possibly an x-ray, and some therapy in hospital. The fast-track waiting room list is based upon patients that require possibly just an x-ray or a simple cast. The determination on which waiting list you're on also influences your wait time. The triage nurse you speak with is able to provide a few standard medications for common illnesses if they think it is appropriate. A common example is pain or fever. They can provide Tylenol or Advil during their assessment. You can give your child these type of pain medications before arriving. Don't worry, this will not impact our assessment in the ED. For children who come for vomiting or diarrhea, they may provide electrolyte solution for the parents to give their children while they are waiting. The other thing the nurses may do is give teaching handouts related to the problem your child has. This will give you some information to read while waiting as well. After being seen by the triage nurse you speak with, they will direct you back to the waiting room. Our emergency department has 2 sections in the waiting room. One we refer to as the clean side, where we specifically try to keep newborn babies and avoid putting children with fevers, cough, or vomiting and diarrhea. You will next be called to one of the admitting rooms, where a clerk will need to register some details about your child, including contact numbers, address, and the name of their regular doctor. You will be called over the intercom by one of the admitting clerks, so please listen out for your name. This process takes a few minutes, and once it is complete, you are set to wait in the waiting room. Your child can eat, drink, or play, except if you suspect your child has a broken bone. We request these children to have nothing to eat or drink until seen by a physician. Sometimes it can be very busy here in our emergency department. Please be patient. If you've been waiting for over an hour, a triage nurse will come out again and reassess you to make sure that your child's condition has not changed. If you have any questions for the triage nurse in the interim, or if your child's condition has changed, please go up to them and just wait in line again and let them know that something has changed. You will be seen as soon as absolutely possible. What can you expect once you are called back? You will either be called back to the fast track area or the main area by a nurse. Most of the time, your child will be weighed and then taken to their room. Another set of vital signs may be done at this time. Once you are called back, there may be additional wait in the room. Rest assured that you will be seen as soon as possible, but it is common to spend a couple of hours within a room. The Alberta Children's Hospital is an established teaching facility, so please be respectful to the different types of learners that work here, including medical students, paramedic and nursing students, or resident doctors. Your child may be seen by a variety of different healthcare professionals and their students. There's one more thing that you should keep in mind when you visit us here in the emergency department. We have a certain patient flow in mind, which means that when your child spends some time in one of the rooms, they may move to another room depending upon what investigations or treatments they need. Thank you so much for watching this video, and we hope you found it informative.